Good evening, everyone. I'm Dr. Deepthi Bawa. I'm a consultant in Aster CMI Hospital, Bangalore. I'm a consultant in the IVF and Infertility department. And today we'll be talking about when you have to plan your pregnancy and regarding fertility and when you need to plan, and if there is a difficulty, when is the right time to come and meet your doctor. So a few things about fertility. Now, if you are a couple who are married for a year and trying for 1 year continuously and not able to conceive, it is right time to come and meet a doctor to find out if there is any issues. If not, at least you will be rest assured that things are all okay and you can carry on trying further. And if your age is about 35 plus, and then there is short of time, and then within 6 months of unprotected intercourse, and if you're not able to conceive, then it is the right time to come and meet a doctor. So these are the basic things that when to come and meet a doctor. And in case if you are a person who already has some problem, like if you have an irregular cycle or related to PCOD or endometriosis, then it is not right that you wait for long, because age, when there is already a problem, and as much as you wait further, things will only worsen. So the earlier you take help, it is better. Age is very important factor both in terms of male and female. The earlier or younger you come for treatment, the easier it is to treat you and the better is the results. So whether it is a regular fertility treatment or if you have to go for an IVF treatment, in both the cases it is always better that you meet the doctor first at the earliest and get your problems or queries answered. To begin with, fertility is an increasing problem nowadays. Especially we see more and more crowd. Maybe it is because the age of marriage is increasing, so people are getting married late. And second thing is because of the career, you're planning pregnancy in a later date. So both these reasons, so age is more important. So both these things are something important that can delay pregnancy. So in people working, especially in IT, they delay the pregnancy for some reason or the other, and if you already have some problem, that's a reason we find more and more infertility, both female and male infertility is on the rise. It may have something to do with our the place where we live, the air pollution, the water pollution, and also the smoking and drinking habits can also increase the fertility issues. So male fertility is on the rise, both in urban and rural areas, and maybe, as I said, it could be because of the polluted food and water and air that is there around us, which we can't really help. But at least if we come to know that there is a problem, we can help you at an early stage. So coming to meet a doctor, at least for a consultation or a counseling, is very important when it comes to fertility. So that is one thing which I want to stress upon. Second thing is now most of the patients, at least 90% of the patients I see nowadays with fertility issues is related to PCOD. Now PCOD is just because you have PCOD doesn't mean you will have infertility, but if it is not well controlled, or if it is something that is there for a long time and untreated, then that group of people definitely may have a problem in conceiving. So within a period of 1 year of marriage, trying for a pregnancy not happening, irregular cycles, putting on weight, having hirsutism, these issues, then it's better that you meet the doctor for a right treatment. And also when you go to a doctor, most of the time we see that you will be given some medication and they tell you to try naturally on your own. So what happens is every time a medication is given, especially for ovulation, if it is not monitored with serial ultrasound and seeing that you are ovulating or not, you are losing both time and money. So whenever you are taking any ovulation induction drugs, where you are doing it for the benefit of ovulation, it is always better that it is monitored with ultrasound, so that at least that time when you've taken the tablets, you know for sure that it has been, the treatment has been proper. Otherwise, you're only losing time. You won't know what is wrong, whether by taking the tablets, have you ovulated, have you not ovulated, is that the reason for not conceiving? So all this, because once you take the treatment, the doctor can't keep on giving the same medication again. So that is the reason whenever you go to a doctor and take these medications, make sure that you are monitored and also that you are sure of your ovulation. Then at least we can think of something else as being a problem. Now when it comes to infertility in a man, there's only one test that we do to confirm that everything is okay. So if a semen analysis is done, which is very, very important, because 40% of the problem of infertility is just related to male. So if the semen analysis is normal, 40% of your problem is solved. And then comes women, where we have a lot of tests which we need to do, because we need to see whether, first stage is whether your cycles are regular, whether you are ovulating properly. So if that stage is also okay, then comes whether your tubes are fine. So that is very important. If everything is fine but your tubes are damaged for whatever reason, then the conception, whether it is naturally or by IUI, is difficult. So it's very important that we have to check your tubes either by simpler methods. We have like hysterosalpingogram, where you push a dye and take an X-ray. That can be done, and or further, more conclusive report is by doing a laparoscopy and looking for directly for any stellate. So these are two ways of finding out whether your tubes are normal. So this is the second stage, where you know you're ovulating and your tubes are normal. Then comes uterus, whether there is any anomaly, uterine anomaly by birth. Is there any problem, or is there any kind of polyp or something? All those are the next level. So when all this is fine, then we go ahead with the treatment according to what your problem is. So a basic investigation, I would say, go for a semen analysis, check whether you're ovulating properly, get an ultrasound to look for whether any problems in the uterus or whether you have any endometriosis. Now that is another set of people who come with either, even if you have one child, conceiving the second child also becomes difficult sometimes if you have endometriosis. Endometriosis is something that you have a cyst in your ovary where there is blood inside that. So every time you have bleeding, there will be severe pain, and this bleeding can increase the chance of adhesions. The tubes can get damaged. The chance of having a normal egg or ovulation regularly can be an issue. So these are some of the reasons where secondary infertility also happens. So first time you wouldn't have had any problem, you would have conceived naturally, but to have the second baby you might be having problems. So then if you have endometriosis, again, depending on the size of endometriosis, we have different ways of treating it, whether it is medical treatment or surgical treatment. Based on that, we go ahead and advise on that. So it is very important, if you know you have endometriosis, it is better you meet the fertility specialist before you plan for any surgical treatment. Because once you do a surgery, it is very important that within 6 months, it's your best chance to conceive. Because after 6 months, again there is a chance of recurrence. Once endometriosis, you can't keep doing a surgery every time whenever there is endometriosis. So the first surgery which you plan to do has to be perfectly done and has to be kept your fertility in mind. Because when you do when a surgery is being done, there is a chance that most of the ovarian tissue can be damaged. So it has to be done by the right person, and a clean surgery is advised. And when that is done, by your chance of pregnancy in next 6 months are very, very high. So just because of endometriosis, don't just go ahead and get the surgery done. It is better a complete workup is done before you go ahead and do a surgery. And within 6 months, you have to plan or pregnancy has to be planned. Because sometimes what happens, just now I got a surgery, now I'm not fit to have a baby. That is what the most misconception is. That should not be the thing. Your best chance is immediately of the surgery and within 6 months. So that is one more thing that I want to convey in this talk. So these two, PCOD and endometriosis, are very important. If you know you already have one, seek help early. We have some questions. Yeah, what is the average tenure of treatment before a couple can conceive? A very difficult question to answer, because all depends on whether what is the kind of problem that you have. So as I said, 40% of the time it's a male infertility. If it's a simple one, where we don't, if it's something to do with immunological or undiagnosed fertility, then by simple methods like if maybe IUI or very early there is a chance of pregnancy. But if there is severe problem like endometriosis or PCOD or the motility problems in sperms, then it may take a longer while. Maybe you have to go for IVF or something like that. So yeah, what are the treatment options for fertility? So there are, depending on what the problem is, if ovulation is the only problem, just by giving some medications or injections, the chances of pregnancy is very high. You can conceive naturally just by taking some tablets and injections. But if there is a tubal issue, and if the tubal issue is, if it's a simpler one where we can do a cannulation and open your tubes, again the chance of natural conceptions are very high. But if it is because of tuberculosis and your tubes are completely damaged, then there is no way that you can conceive naturally. You will have to go for IVF treatment. So all depends on what problem a couple has. Based on that, the treatment will be told. So simpler ones is if the ovulation is the only reason. What causes infertility? As I told you, this is a different stage. In men, it could be because of the wrong lifestyles or genetic causes, that motility or the counts can come low. And if the counts are low, we have some medications which we do give and observe for 3 to 6 months. And by that time, if the lifestyle is changed and the medications work, in 6 months we will see good results. And the patient conceives naturally. But within 6 months, if things are not changing, then we suspect that there is some genetic related issues and which cannot be corrected by medications. Then probably you will have to seek, IVF or ICSI. So one of these treatments can be offered. And another very severe form of male infertility is something where there are no sperms at all, which is called as azoospermia. So in that case, we do a couple of investigation like a scan and a blood test to see whether there is a problem in the production or whether there is a problem in just the obstruction in the way. So if there is a problem in the pathway, that is, there is an obstruction, then sometimes some surgery can help, or we go do something like a TISA, where we retrieve the sperms from the scrotum, and then that can be used for IVF or ICSI, and then they can have their own children. But if there is a problem in the production, then it is again related to genetic, and the chances of them having their own children is very low. So, yeah, these are few things. And so going further with the treatment, what are the other modalities? So one, I said, if the ovulation is the problem, we give medications and try. And then if that part is achieved, then we look into the tubes. If tubes are fine, then we go further ahead and see for any immunological reasons. There's also some problem like, patients get pregnant, but they lose the pregnancy. So we categorize them as recurrent pregnancy losses. So that also comes under fertility. What happens is, if a patient has 3 consecutive pregnancy losses, then we consider them to be having some problem. 1 or 2 pregnancy loss in the beginning, in the first 3 months of their pregnancy, we do not take things so seriously because it could be because of some chromosomal anomaly. It can happen to anybody, a normal couple. But if there is a consecutive 3 pregnancy losses and all in the first trimester or beyond that, then we have to go ahead and investigate what could be the reason. So one of the most common tests that everybody does is the torch. The torch is a blood test where we look for all kind of infections, especially rubella, cytomegalovirus, toxoplasmosis. So these are some of the infections that we look for. General notion is that once the torch causes some abortion on a person, it does not, like if you have a rubella infection which has caused an abortion, then once you get rubella, it's a lifelong immunity. You don't have to treat it, or that doesn't cause a recurrent abortion. Whereas sometimes, cytomegalovirus or toxoplasmosis, if it is not treated, that there is some chance that they say that it could be one of the reasons for recurrent pregnancy losses. But otherwise, recurrent pregnancy loss, generally torch is not a reason. Then comes what else? Then we look into it if there is any uterine anomalies, like there is by birth, whether there is a double uterus or there is a septum, like there is a instead of one chamber in the uterus, there could be a septum which separating the normal uterine chamber. So that again can cause recurrent pregnancy losses. So a lot of uterine anomalies can be one of the reasons, and immunological reasons are there. And other than that, again coming back to genetic problems. Yeah, so coming back to recurrent pregnancy losses, so if a patient has continuously she's aborting, then we have to do a chromosomal study to see if there is any problem in the fetus that is aborted, or there is a chromosomal problem in the parent. So these are the basic thing that we do. And also, as I said, hysteroscopy or an ultrasound to find out if there is any uterine anomaly. It could be some kind of an infection, as I said, or it could be immunological problems. So that could be, we do some blood tests like anticardiolipin antibodies. So that what happens in this is, if you just give an injection right from the beginning of pregnancy, and the chromosome part is normal, then that pregnancy can be taken till term and you can have a normal child. All that has to be given is the injection. So these things, if we find out right from the beginning, these are some of the treatable causes of recurrent pregnancy losses. But if there is some genetic issues, certain genetic issues we can find out early, and if it is a single gene disorder, through, if not by natural, by means of IVF, we can find out even before putting the embryos whether we can find out if that particular problem exists in that embryo, and we can, if that is there, we don't have to put that embryo. We can put a clean embryo so that that child is born absolutely normal. So these are some of the advantages of doing an IVF and PGS, PGD technique. So these are the advanced things that we do, where a patient knows that they have a genetic problem, or one child is already affected with a genetic problem, and further we don't want to go through that trauma. We want to know beforehand, before conceiving, that this child is not suffering from such a problem. Then we can always do these things. Depending on what the problem, if we know it, then we can do a PGT, find out the reason, and then if that particular embryo does not carry that problem, we can implant that in the mother, and then pregnancy can go as naturally as possible. So modalities, I said, by medications, or we can do IUI. IUI is a simple technique, just like a normal pregnancy, where it's a timed procedure, where we take the husband's semen, we process it, and only the fast moving ones we put it through a cannula and we inject into the mother or the wife. So the chance of pregnancy from natural increases by 20-25%, and it bypasses, so it bypasses the cervix area. So the chance of pregnancy is much more higher here than natural. So that is one more simpler technique. It can be done many times, and if that also doesn't work, then as a last option we have IVF to offer. IVF is in vitro fertilization, where mother is stimulated right from the second day of her periods. We give injections for about 10 to 12 days based on how they are growing. So once they all come to a mature stage, we remove the eggs out of their body and fertilize it outside the body with the husband's sperm. And then once they are mature, about 2 to 3 days, we put them again, implant back onto the mother and wait for 15 days for the results. So this is the technique of IVF. And also we have an advanced technique called as ICSI, where single sperm is injected into one egg and we see for fertilization. So that is mainly used where male infertility is the problem. So the chance of fertilization is very high, and same way, because of which the chance of pregnancy also increases. So age. Coming to age, as I told in the beginning, age is a very important factor when you're planning a pregnancy. I wouldn't say which age is better, because the younger you are, the better, younger the eggs and younger the embryo, better the chance of conception. As the age increases, I would say anything above 30, the chance keep coming down, and above 35 it starts falling, and above 40 we have a drastic fall. So I would say the younger you are, and if possible, plan a pregnancy much before 30 years of age. So that is the ideal time to plan the first pregnancy. And if what happens is, we are all, ladies are born with the fixed number of eggs from the time you're born. So it depends from one person to person based on their genetic makeup, what would be the number of eggs that a lady is born with. So it decreases faster and faster. In some people, by the age of 35 itself, we say they have gone in for premature menopause, where all the number of eggs have depleted. So then we can't even give them or offer them a chance of IVF, because they do not have eggs. There's no medication, or there's nothing that we can do to increase the number of eggs once they're depleted. Very few medications here and there we do give, but nothing that's like 100% proven that can increase the number of eggs. So if the reserve or the AMH level is low, then it should ring a bell that, it's high time pregnancy has to be planned, and plan your baby. Once above 35, it is a little difficult, and it will keep coming down, and it will only keep coming down, and then there will be a drastic fall, and beyond that point, nobody can help. So those are the things. Thank you.